It's time for another session. Loving homeopathic doctors, people working in various fields of homeopathy, relatives, friends, well-wishers, and masters of homeopathy. Good evening, good afternoon, and good morning to all. Let's begin with a silent prayer. I welcome you all to another beautiful day of knowledge and unity. 896th day of Zoom meeting on international session. It's my indeed pleasure to welcome the guest for today, Dr. Shierly George. She is here for the first time in our platform. She has a 25 years of experience, in which 6 years of teaching experience at Martin Homeopathic Medical College, Coimbatore. She has served as examiner for 30 exams in various universities and presently working as a guest faculty at Shivaraj Homeopathic Medical College, Salem, Tamil Nadu. She has an advanced diploma in diet and nutrition from John Academy, UK, and the Sick Kids Public Health Nutrition course at Sick Kids Center for Global Child Health, Canada. Her eminent works include Viva in Gynecology and lots of articles in journals, in various journals. Today, she is here to discuss with us the topic nutrition and lifestyle in pregnancy. With all respect and love, I welcome you, ma'am, for today's session. Welcome, ma'am. Ma'am, can you please unmute?
Good evening. Can you hear me?
Yes, ma'am. Yes, we can hear you.
Good evening, one and all present here. This is my first session, I think, here in this platform. Thank you for inviting me. So today's topic will be nutrition and lifestyle in pregnancy. Why I chose this topic is nowadays people are unaware about the health benefits we get naturally and how it helps in safe pregnancy. So research and recent studies. Can I have the slides, please?
Ma'am, you can talk as we share the slides.
That is like research in recent decades have shown that nutrition in pregnancy, along with nutrition before pregnancy, is equally important. That is why for the long-term health of the baby. Nowadays, children don't care about the health these days, like taking food, nutrition, how important it is for the future development of the child. So it has a long-term health benefit along with brain growth and development, cognitive function and achievements, immunity functions, behavior, educational achievements, risk of allergy, autoimmune diseases, health and other outcomes. So all this depends on the health of the mother before and during pregnancy. So it has a later effect also in children, like risk of obesity and associated risks such as heart attack, stroke, diabetes, and cardiovascular diseases also. So this is the main thing or the introduction I would like to say about today's topic. So what to say, planning for a pregnancy is very, very important, equally important. Like how nowadays marriages are done at great pomp and show. For planning a pregnancy also, a woman should be very cautious. Before planning, the woman should have a ideal body weight and regular exercise, counseling, and allow counseling and advice for good health. So treating any maternal illnesses now, like PCO is very common these days. So treating any maternal illness is very, very important, or any thyroid related issues, endometriosis, and any systemic diseases are also very important before planning a pregnancy. So they have to optimize their nutrition and lifestyle before planning for a pregnancy. So the pre-conception care is also very important. Like the paternal health is also very important. Usually fathers to be think that they don't have any role in like the dietary and nutritional role for pregnancy, but fathers also or father to be has to take care of his health and lifestyle. As a father's sperm can be affected from conception through the production of mature sperms much later. So they have to check on their obesity, that is their weight, diabetes, any micronutrient deficiencies like zinc deficiency, because this also can affect the sperm quality and fertility. And if they have any bad habits like smoking and alcohol consumption, that should be stopped. Then good physical activity is also very essential. So both maternal and paternal health contributes to pregnancy, that is before and during pregnancy. Preconception care is also very, very important. It is an essential part and of and preventive care for all the women of childbearing period. So all of them should take equal care before conceiving. That is, women from the adolescence itself should have receive advice on how to promote good health and what diet should be taken and follow a healthy diet pattern. So if they are in the habit of any lifestyle habits like smoking, alcoholic consumption, overweight, they all will lead to risk of pregnancy complications. Mostly neural tube defects are caused by suboptimal levels of folic acid. So folic acid is very, very important. And this is, folic acid is very important. Maternal weight also, even just like how overweight is causing problem, maternal underweight also causes problem during pregnancy. So because it can cause preterm birth and low birth rate. Like it is very, very, it is recently, it has been shown that studies was done in the Holland during the World War. And it was seen that they, because of scarcity of food and famine, the ration allotted was very, very less, like only one potato and 2 slices of bread and some bit of sweet sugar cane or something. Only that much was given as ration for even expectant mothers also. What happened that a hospital in Holland at that time recorded the nutrition and the outcome of child born during that period, showed that all the children were having complications, cardiovascular complications, obesity and all in later life. So just like how overweight is risk for pregnancy, underweight is also a risk for conceiving. So it is where then like added sugars. Nowadays, all the fast food and packaged food all have excess of sugar and salt. So that should be avoided. And sugar should be restricted to 5 to 10%. And salt should be restricted to 2 to 3 grams per day. So nutrient density food only should be consumed. Nutrient density food means food that is high in nutrition, which and related to the energy. Nutrition related to energy, amount of nutrition that can give energy to the person. That is nutrient density food. So all adults and exercise, like all the adults should maintain a minimum of 2.5 hours of intense physical activity each week, both males and females also, before conception. That falls under preconception care. So first 5 weeks or after conception, first 5 weeks after conception is a crucial period in any woman's life, because this time is a time which can cause lifelong consequences in the baby, because this period is when the organs start developing. So reduction in low energy food can cause obesity, heart diseases, and diabetes in later life. Starvation and low energy diet can also cause non-communicable diseases in adult life and low birth rate also. But what happens is usually the first 5 weeks, the mother will be unaware of the pregnancy and will not be able to take care of herself because she doesn't know that she is pregnant. Diet will be very. So nutrient density food. What are all the nutrient density food? Mainly vegetables. All the green vegetables and vegetables, broccoli, cauliflower, cabbage, carrots, all these vegetables are nutrient density, highly dense in nutrients. Then whole grains, oats, barley, wheat, rice, seafoods, all rich in omega fatty acids. Legumes like anything, dal, or all the grains we consume, legume pulses, chana dal, or all that which has a pod with beans. uh, Eggs are very, very important because eggs contain biotin, which is very essential for early brain development. It is the only food which contains biotin, which is absorbable. Then unsalted nuts and seeds, low fat dairy products, lean poultry and meat. These are all the these are all the foods which contain high density nutrition. So, like, why obesity? What are the effects of obesity in the mother? Effects of obesity are risk of miscarriages and stillbirth, macrosmia. Macrosmia means big-headed babies, gestational diabetes mellitus, hypertension, excessive weight gain. Already the patient will be overweight, and again there will be an increase in weight during pregnancy. So there will be excessive weight gain. Then folic acid, or it is also called as vitamin B9. Folic acid is a very essential for synthesis and repair of DNA. And actually, our body cannot synthesize folic acid. So it is very essential to take folic acid externally. And what happens is, though folic acid is present in fruits and vegetables, what happens, some amount of it is lost during cooking, as natural folate is unstable. Children and adults require folic acid to prevent anemia. Folate means leaf, Latin word, it is a Latin word, which means leaf. So foods which contain folic acid are dark green, leafy vegetables, legumes, citrus fruits, food and juices, and fortified foods. I don't know if we have it in India, but most of the developed countries, they give breads and other cereals fortified with folic acid for all mothers, expectant mothers, and people willing to conceive. It is given as routine for all expectant mothers. So apart from all this, so what we need is 400 micrograms of folic acid should be taken for 1 month before planning to conceive, which should be increased to 600 microgram during pregnancy and up to 12th week. And 13th week, it should be 800 microgram. Only up to 13 weeks, folate is necessary. Though because it is very essential for the neural tube, the development of neural tube. So neural tube deficiency of this folic acid can cause neural tube defects like spina bifida. Cleft palate can also be there because of neural tube defect. So all this food containing folic acid should be taken. So the main thing is what are all the checkup that is necessary? What checkup should be given to a woman during pregnancy? First of all, urine Grav index test is done. After that, a confirmation USG. Why confirmation USG is important is, it is to confirm that the fetus is in the abdomen and not an ectopic pregnancy. That is the main thing. And if it is corresponding to the weeks of pregnancy, that is the reason we confirm pregnancy with ultrasound. Then 12 weeks, you can do a nuchal translucency scan, NT scan. This scan is to know if any development, any abnormality is there in the in the baby, like any congenital defects can happen. So all this is done during up to 11 to 13 weeks, NT scan. Then triple test. Triple test is very important. It is called as a triple marker test, which is done to detect alpha fetoproteins, HCG, and estriol. So if there is high level of alpha fetoprotein, it indicates that there is something wrong with the baby, that some abdominal problem. Same way, if HCG levels are low, it indicates that it can be ectopic. And if the estriol level is low, it indicates some kind of congenital anomaly or any DNA abnormality in the child. So triple test is very important. And also very high levels of HCG indicates molar pregnancy. The other blood tests are the routine blood tests, CBC with ESR, and then for sugar, all these tests, and any lipid tests can be done. And normally USG is usually done at 18 to 21 weeks. And it is used to detect any fetal abnormalities. Why it is done up to 20 weeks is for if there is any need for termination, that can be in case of any abnormalities, it can be done. And one more thing is anencephaly is also another reason for this folate deficiency that can also be identified. Then fetal echocardiogram, the heart rate and the fetus heart, if there's any anomaly, heart anomaly, that can be done between 23 to 25 weeks. Fetal echocardiogram, that is when it is done. So this regular health checkup is very essential during pregnancy. And how homeopathy can help? What is our role in this during pregnancy? It's just very, very important. Usually only patients who are familiar with homeopathy medicines will come to us for treatment. Others don't. We cannot expect all the pregnant women to approach a homeopathy doctor for treatment. Only the people who are familiar or who are already patients and they have conceived with homeopathy, or they are already patients with a homeopathy doctor, will approach a homeopath for their complaints during pregnancy. Mostly the complaints that occur during pregnancy and which we can help is hyperemesis gravidarum, hyperemesis or excessive vomiting in pregnancy. Most of our drugs can help to some extent in hyperemesis gravidarum. Then another one is GDM or gestational diabetes. Gestational diabetes, we have plenty of drugs to control sugar during pregnancy and maintain a HbA1c level within 6.5. And hypertension complicating pregnancy. Hypertension complicating pregnancy, very, very effective. We can control hypertension during pregnancy with our drugs. Then cervical incompetence. Cervical incompetence, I had a very cervical incompetence is you see the cervix length in USG, and if it is low and the cervix os is open, we can help with our medicines for cervical incompetence also. And miscarriages like missed abortion, like baby, when you did a USG early in the first trimester or an early scan, the baby had heartbeat and it disappeared in the 8th or 9th week of scan. You call it as a missed abortion. And so the baby doesn't have a heartbeat, and miscarriages can be prevented when you have a BOH. So when the patient is presenting with a BOH, with our medicines, abortion can be prevented. Then placental complications like placenta previa or abruptio placenta. All this also with homeopathy we can control and we can prevent the complications. Amniotic fluid discrepancy. Many patients these days, it is very, very common these days that the amniotic fluid index is very low, AFI or the amniotic fluid index. These patients come with amniotic fluid with less than 10. and corresponding to the weeks of pregnancy. Only mostly it is relevant only from 26 weeks. So you see how much of amniotic fluid is there. We can advise, dietary advice can be given, telling the patient to take more protein. I have seen considerable increase in amniotic fluid when given a diet containing 2 eggs daily with enough protein like dal, green gram regularly, and fruits. And instead of, most of the people think that amniotic fluid is related to water intake by the patient. It has nothing to do with the water intake. It is only the amount of protein should be increased in the diet, and the fluid level will become more. It is, there is a it is highly related to the diet. So eggs, protein food, mushrooms, like vegetables containing high amount of protein, if given to the patient, there will be a high amount of increase in amniotic fluid. Then gastric ailments during pregnancy. So most of them, when they have vomiting, that can cause gastritis. So gastric ailments in pregnancy, like burning of abdomen, then not able to eat, then having stomach pain, false labor pains, which is very difficult to identify if it is a labor pain or a gastric pain. Then already patients having any gastric related complaints like ulcer, all these patients, all the complaints will increase during pregnancy. That is when we can intervene. Then intrauterine growth retardation. Intrauterine growth retardation is when the baby's growth does not correspond to the weeks of pregnancy. In intrauterine growth retardation, what happens is the abdominal circumference is less than the other parameters. So we confirm it as an intrauterine growth retardation. With homeopathic medicines, we have seen very good results for this also. Then, as you know, our easy delivery medicines are there. Most of the doctors are giving patients easy delivery medicines like Colophila, Macchiaracimosa, Gelsemium, Pulsatilla. All these are the common remedies for easy delivery, and which helps the patient in delivering, having a safe delivery and a easy delivery and a normal delivery. So these are all, this is the main role of homeopathy in pregnancy. In hyperemesis gravidarum, when there is excessive vomiting, all of our vomiting remedies, Ifph, symphoric apis, arsenicum album, sepia, pulsatilla, all these remedies play a very, very important role in this. And like in gestational diabetes also, Helonius and all our tinctures, commonly used tinctures for diabetes, help very good well in optimizing the diabetes mellitus. So like though this topic is about diet and nutrition in pregnancy, I would like to present a case of food allergy. A case of food allergy, like it is about a young girl, a 20-year-old girl. She's staying in the hostel. She was staying at home, and then for her education, she had shifted to the hostel. So what happened is, for the past 6 to 7 months, she's not able to tolerate dal and any of those related to dal, like green gram, channa, or black gram, any dal in any form, she was not able to tolerate. So somebody told her, she tried all the medicines, Ayurveda and our allopathic medicines, it didn't help her. So one of her friends told her that she got relief taking homeopathy. So this girl came to us for treatment. What the main complaint is, cannot tolerate dal in any form. So what happened? She was there was nothing else to say. Like when she takes dal, see, dal is our staple diet. No, in South Indian diet, dal is very important. So sambar or anything with rice, mostly people have dal. So she's not able to tolerate dal. And 6 to 7 months this has been going on. Whenever she takes dal, what happens is she has headache, severe headache. nausea, then bloating of abdomen and choking. Then unless she eliminates that food, she cannot get relief. And mostly she used to take paracetamol for this. And only after taking paracetamol for headache, she used to get some relief. So this headache was very, very, very intolerable. Nausea also. So she cannot take food properly. Morning, if the breakfast, she has idli and dal, sambar or anything, it starts. Headache, nausea, bloating. She cannot travel also. And after 1 or 2 hours, all the symptoms will start. She will not be able to have lunch. She cannot cope with her daily activities. This is how she was. This is the presenting complaint. And only is relief she gets is with either vomiting or passing stool. So like when we took the history, we came to know that all her physical generals like appetite, thirst, motion, except during the complaints, urine, desire, everything was normal except for her menses. Menses, she has a history of PCO, and menses is once in 40 to 45 days. And after USG has given us diagnosis as polycystic ovaries. Then so I couldn't get much from the physical general. Mental generals like she weeps easily, cries easily, irritable patient is irritable, and she whenever whatever you ask her, she says, I'm very strong mentally. I don't get I'm not weak at all. I'm very strong. But actually it was faking to be mentally strong, fastidious. Everything should be neat and tidy, and uses only branded clothes and articles. Using branded clothes and articles, it's a personality, I feel. It has nothing to do with our medicine, with our case taking, but just mention that it is, she's taken it down. It's a kind of obsession, using only branded clothes and articles. Then another one thing was consolation gives her relief. If she cries easily also, she gets consoled easily. So, and she feels better after being consoled. Then heart patient likes open air. Then when taking the family history, there was a history of carcinoma from the paternal side. That is, both the grandparents died of carcinoma. So this was the highlight. This is a highlight of the case. The generals, physical generals were all normal. All the physical generals like appetite, thirst, sleep, desire, aversion, nothing specific in all that. And except for the irregular menses, but it was not bothering her actually, because she was maintaining her weight and eating well and exercising regularly. So that was not a botheration. Only this symptom, like not able to tolerate dal, was a highlight. So based on that and based on her complaints, we prescribed Pulsatla 200, 4 doses, weekly 1 dose. We gave her Pulsatla 200. Then followed with Natrum 466, that was given daily for 1 grain tablet 2 times daily, morning and night. And carcinosin 1 dose intercurrently it was given. What happened was, patient's mother called me, and she started crying. She couldn't control her tears. She was so happy. Then she said, see, doctor, I didn't want to message you because if I message you, it is not enough. I cannot express my happiness and gratitude. My daughter had dosa and sambar in the hostel for breakfast today and nothing happened. I'm so happy, and she was crying. That is how this case. So our homeopathy can do wonders, and that is why it is taken. I've written patient took dosa and sambar after many months. Imagine the happiness. She was so happy. So she likes dosa and she likes sambar also. Imagine. And patient's mother was very, very happy about this. This is a case I presented. And, if you have any doubts.
Thank you, ma'am. Thank you. Thank you for a beautiful session, ma'am. We are very enlightened with this session, as the topic itself is very thoughtful and important. Even though we may be familiar with this topic, and I think everyone will be having their own opinions and suggestions. Now we are more detailed with all minute details about this topic, as ma'am has presented it in a orderly manner, which is very appreciable. And last, she presented a wonderful case also. So thank you, ma'am. Thank you for this beautiful presentation. Now we will have a discussion on this topic. So you can raise your hand and can ask doubts with ma'am. She will answer your doubts. Now you can raise your hand. Ma'am, there is a question in chat box from Dr. Amina. How do you plan for a easy delivery? The question is like this, ma'am. Ma'am, please unmute, ma'am. Unmute your.
Planning for easy delivery is we can give the patient medicines according to the symptoms. So from day one, the patient has known that she's pregnant. Maybe she'll come to you at 4 months, or maybe later, or only from 8th month. Never know. So if she's coming to you from 4th month, you can give her, actually you can advise her what all she can do for early pregnancy, like moderate exercises, then food and nutrition, all that. But we can start with, for easy delivery, medicines can be given right from the 36 weeks onwards. 36 weeks, you can start the medicines like Actia racemosa, Colophylum. Then during delivery also, all these medicines can be given. Actia racemosa, Colophylum, Gelsemium, Pulsatilla, depending on the patient's symptoms. And if there's very severe pain, Chamomilla can be given. So like in one case, the patient's father was in touch with me, because they were very good, good patients of mine, and very, committed to homeopathy. And so much they have belief in homeopathy. And during the delivery, the patient's delivery was to be on 13th of April. But what happened? One day it got delayed. And no pain at all on 13th. So the doctor was planning for Caesar on 14th. So what happened is the patient's father was in touch with me, and we told her to take Actia racemosa and Colophylum, both the medicines, alternating in every half an hour. And what happened? The next day, surgery all was planned by, it was planned by the doctor. But what happened? At sharp 8 o'clock in the morning, the patient had pain, and the medicines were continued. She took the medicines and she delivered normally. So according to the symptom, you can give Actia racemosa, Colophylum, Gelsemium, Pulsatilla. These are the main medicines, drug confidence. That is why I'm telling these 4 main medicines. There may be other medicines also, depending on your experience.
Thank you, doctor. Now Rasa has raised her hand. Rasa, his hand, please. You can unmute and talk now.
Hello, Bob. Thank you for your good session. I have a question about eclampsia and pre-eclampsia. How do you manage eclampsia? Thank you.
Eclampsia and pre-eclampsia can be managed. Like, first of all, the patient, she should have sufficient belief in the homeopathy system and the doctor also. So for pre-eclampsia and eclampsia, normally what are all the medicines we give, depending on the patient's history. So Veratramalbum was one medicine that I gave for the patient, because after the case taking, and the blood pressure was around 160/100 during the 8th month, and she was her doctor was asking her to take. So suddenly the BP shot up. Okay, actually BP was monitored during the early months and it was normal only. From the 8th month, what happened? Suddenly the BP shot up, and the patient didn't want to take any allopathic medicine, and she came to our clinic. And what happened is during when the BP was taken, it was seen to be very high, like 160, 100. And so we gave her medicines, like Veratrolum was a medicine which we gave her, and gelsemium in between, because she was very tensed because of the high BP. Then salt restricted diet. Diet was very, very important. The oil she was using was very important. And we have to prevent the fits that is happening, no, during pregnancy. So preeclampsia and eclampsia, the diet also is very, very important. Protein rich diet also was prescribed, and the patient what to say cooperated very well, and she went in for Caesar only because of the BP, though high, was stable. The patient was very stable. That is how we maintained the case, and she delivered very smoothly, sir.
Okay. Thank you, Dr. Rosa. Now, anybody is there to raise the hand? Doctor, may I ask you a question? What all are the drugs which should not be advised during pregnancy time, as it is a symptom similar medicine?
I didn't get you. What?
Which all medicines should not be given during pregnancy time? Should we take caution like that?
No, I don't think we need any kind of caution, because they say Pulsatilla is used for abortion and it shouldn't be given during pregnancy, but Pulsatilla is given and it has not caused any problem. As far as I know, Pulsatilla is having very good, what to say, it's very useful during pregnancy for all the complaints, women-related issues like constipation, backache, then for helping in smooth pregnancy, then nausea, vomiting, or any ailments, even during what to say, for cervical incompetence also. I had a case of cervical incompetence where the cervical length, you know, like the patient was in the Gulf and she came to India for during the early weeks of pregnancy. Up to 13th week only, you will see the cervical length, because it is very important. If the cervix length goes less than 4 centimeter, what happens is the patient can go in for a early delivery. So 13th week or to 26th week and all is too early. Okay, so what happened is we gave her Sabina. The patient was wanted the doctor, gynecologist with whom I am related to. She has good confidence and belief in homeopathy. So such cases she refers to me. So that is how I get the opportunity to treat cervical incompetence and all. You know, usually they do a cervical encerclage for the patient with Bachelor's os, and they ask them to have a take bed rest, complete bed rest with head low and head low. So this is the treatment they give: cervical encerclage with head low, and after cervical encerclage, and patient should be fully under bed rest. No getting up, no unnecessarily, no taking bath daily. Only once she goes to the toilet, everything should be done, and no more. Only they use a basin and all that. That is how they treat cervical incompetence. So with this patient, she came with 13 weeks, os open, and cervix length was very less. We treated her very well up to 38 weeks, and then they did a Caesar for her at 38 weeks, because we have to remove the cerclage and then wait for normal delivery or for Caesar. Because she was a high risk case, above 35 years, she was a high risk case. Because high risk cases when you're above 35 years or you have any risk factors complicating pregnancy. So related with all this, we gave her pregnancy terminated at 38 weeks and a healthy baby was born.
Okay, thank you, doctor. Thank you so much. Instead of writing in chat box, you can raise your hand, as we will unmute you. Dr. Hariharan has raised his hand. Please, you can now speak, sir. You can unmute, sir.
Okay, okay, doctor, your class is nice and fine. See, I want to know, the relation between the constitution and the desire and cravings of a pregnant patient, pregnancy. Suppose certain patients are craving for, say, spicy foods. Certain patients are craving for, desire for, say, sour things. Certain pregnancy ladies they want salty foods. Certain food, pregnancy patients needs sugar. I want to know the relation between the constitution and the pregnancy patients. That is what I want to know.
This is very interesting, actually. Pregnancy is a physiology, actually. It is not pathology. So constitution the patient is when she is before pregnant, during pregnancy, there will be maybe a slight variation in the constitution. So pica in pregnancy, pica is common for all pregnant women. Only the pica differs from individual to individual. So some people will crave for sweets, some crave for sour food, some crave for salty food. So depending on the craving, I don't think you need to correct that craving. You give the food, she will be happy.
You think it's so that it not be corrected? Need not be corrected. You think it's so?
Sir, it need not be corrected. Why should it be corrected? Because it is physiology. Every pregnant woman will have some sort of craving and we are learning also, no, pica in pregnancy. So
Okay.
pica in pregnancy is to be appreciated, and the patient should be given, not patient, the lady should be given whatever she desires for, because they say it is for her health. And in Tamil Nadu, they have a culture where during the 7th month, they give 7 tastes to the mother. There's a function like sour taste, 7 kind of food, rice, 7 varieties of food is given to the mother, so that all the taste will be satisfied.
Okay, that is correct, because the body craves that.
Yeah, definitely.
When craves that, see, natrum, she want sodium chloride, so she craves for salt.
Yes.
See, if it is a psychotic pregnancy, that pregnancy lady says, we must give Medornum.
Yeah.
He must give. See, if it is some like cravings for indigestibles, see, chalk, see, sand, these things, you must give the calcarea.
Alumina also helps.
Alumina. See,
yeah, alumina also helps.
So,
I feel what is only if they crave for indigestible things or like chalk, mud and all, you can cure it. If it is for normal eatables or normal food, there's no need to give any medication. No need to.
Okay, doctor. The body don't know which is tasty and which is not tasty.
Yeah, that is what. So you need medicine, no? If it is in food which is not digestible or food which is not natural or not eatable, you need medicine. If she's craving for anything which is normal, you don't need any medicine. It just has to be taken naturally. That's all.
Anyway, it should be corrected. That is my observation. Okay. Thank you very much.
Thank you, Dr. Hariharan. Now, Dr. Suresh has raised his hand. Doctor, you can unmute yourself.
Am I audible?
Yes, doctor.
Dr. Shierly, first of all, I would like to appreciate you. Very good presentation. And one question is, am I audible?
Yeah,
audible. One question is, Dr. Postpartum care, that especially we Indian people are giving more importance about postpartum care. My question is, what is your opinion about postpartum care, and what we can do in homeopathy? Is there any protocol about PP care in homeopathy? Can we give any method? Your suggestion, please.
Say postpartum care, mostly, I would like to mention a few how we can help with homeopathy. So the new mother will have difficulty in feeding the baby, and there will not be sufficient milk. When there's not sufficient milk, our medicines will help to improve lactation. We have plenty of medicines to improve lactation, so that those medicines can be given. Then another one, tiredness, mood swings. Mood swings in postpartum, like depression. No, the patient can go in for postpartum depression. So mood swings also we can treat very well, and with our medicines. Then any other postpartum issues like giddiness. I've had a case where a woman, she had giddiness, severe giddiness. She couldn't even move her head 3 days after delivery. Conium, just a single dose of conium helped her. She it was a very pitiable condition because the patient couldn't get up from bed and she didn't pass urine from morning till evening 4 o'clock because she couldn't get up from bed. What is to be done? She's gone home. That was a normal delivery, and so she was home, and they didn't know what to do. But because there was a nearby homeopathy doctor, they approached the doctor. Just a dose of conium helped her. Just with one dose, she got over that giddiness, and she was able to get up and sit and move to the toilet. So in all those cases, a lot. Then what are the helping in urinary tract infection after delivery, UTI? Our
Yeah.
Candidus, our equisitum, then the acid benzoic, all these remedies, including other, I'm not able to recollect many, all those remedies help for UTI. Then constipation. See, in case of normal delivery, what happens is there will be that episiotomy, suture will be there. That is very painful. So the episiotomy suture prevents the patient from straining for motion. So our Nux vomica, it is very, very good for constipation postpartum. Any other related complaints also. These are the things which are coming in mind, lactation difficulties, constipation, UTI, giddiness, postpartum depression. For all these, very good medicines are there in homeopathy.
Yeah. So I think
Then-
your opinion is postpartum care is necessary only if there is any anomalies after delivery, isn't it? Abnormalities seen in after delivery.
So I didn't get you, sir. Can you please repeat?
The postpartum care, actually, it's a procedure. In India, especially Indian system of medicine, giving some procedures after delivery. So like that, we have no procedures, but it is necessary only the delivery. After delivery, if there is any abnormality seen, we can give any medicine, isn't it? Your opinion? You understand?
Yeah, I got your question, sir.
Yeah.
Usually what happens is, for all these, conditions, they come for homeopathy, like anything from normal. But generally, for the oil bath or for the massage, everything, they go to the Indian system of medicine.
Yeah.
It has become a trend, or you say it is followed for generations, that
Yes.
Ayurveda is better postpartum, after delivery,
Yes.
for
Yes.
the mother and the child. So that may be the reason we don't get the opportunity to intervene.
Yeah. Okay. I think can you suggest any procedure? It is better like that Ayurveda after delivery. We can make any procedures to give the delivery ladies after delivery. We give.
After delivery, for homeopathy, is apart from all this, maybe for oil bath, oil massage, we can use any of our oils, like Rustox oil is there, arnica oil is there. If they're having any pain, joint pain, body pain, before instead of using Ayurveda oil, you can use this. Then if they have any indigestion, they can use our homeopathy medicines.
Yeah.
And for the baby or for increasing the lactation, for the mother can use homeopathy medicines. Then what else? These are the things usually they give in Ayurveda, no? Some, what to say, for digestion, for appetite, for body pain and strengthening the muscles after delivery. But
Yeah.
if it is a Caesar or LSCS, I don't think this has any, what to say, much relevance.
Yeah. Okay. Now, also they are giving some medicine for the fitness of that lady in Ayurveda. In Ayurveda, they suggest some procedures for the fitness of the lady.
Yes, yes, yes. That's what I said. They give oils and arishtam and all for the
Yeah.
mother's health.
Yes.
So the same way, they don't come to us. If they come, we can give ginseng or alpha tonic for the fitness.
Oh, of course. Why not? Yeah.
Yes, thank you, Dr. Suresh. As we have Dr. Veena, she has raised her hand. Now, Dr. Veena, you can ask.
Oh, good evening, doctor. An excellent session from you. It's really a great experience to see Pulsatla weekly prescription in a lady with hyperemesis. That's a great work. And I would like to add here like 2-3 things. One is regarding the pica. Pica is a perverted taste. So that should be treated, no doubt about it. But if a person has a craving for salt or sour things or sweets, I generally believe like if there is any deficiency, the body craves for it. So this is what I believe. So I generally ask them to go by their taste buds because our tongue is the right thing to judge what our body requires. So even in children, if the child is having recurrent colds and all, they in allopathy, they generally say to avoid some allergic fruits, sweets and all that. But if the child craves that, it's better to give it. So this is what I believe in. So the deficiency which may be there in the patient would make the patient crave for certain things. So that is why they develop normal taste for these type of food or fruits or particular taste. This is one thing. And regarding LSCS, I think postpartum, definitely we have good medicines of Staphylococcus aureus, arnica to be thought of. And third is, as you told, the Actiaresmosa and Colophilum is the best prescription for easy delivery. But they don't wait in post-dated pregnancies. So I think our treatment for early labor should start at least 10 days before the expected date of delivery, which is given in the scan. So which may avoid unnecessary delay or unnecessary sections. This is my experience. What is your thought about it, doctor?
Thank you, doctor. Like what I feel is pica, like how we both have said, it is let the patient, it is depends on the, it's not a pathology, it's only a physiology. Pregnancy itself is a physiology only. So if the patient craves for any kind of food, let them have it. It's not a problem. We will not intervene with medicines unless it is something out of the way or not edible. Then 10 days before delivery, I told you, like from 36th week itself, the patient can start with the medicines, not the easy delivery medicines, other medicines like whatever pain she has, false labor pain medicines she can take, backache medicines she can take. And it's very advisable.
Ma'am,
Only
may I excuse you, ma'am? As we are running in short of time, we
Yeah,
have
yeah,
one more one to ask. So can you make it little bit faster? Sorry, ma'am. Now Dr. Amina can also ask. After that, we will wind up this session as we are running in short of time.
Sure, sure, sure.
Sorry.
And it's better to have take all the medicines like Actiaracimoso, Coliphylum, everything. And I don't think it is necessary 10 days before the date of delivery, maybe a week or 4 days, because it helps instead of 10 days. I don't know. That is my experience. Then one more thing is, like, we can give some 1 dose of Sorinum in the 7th month, not to have any skin complaints for the patient. I've done that and it has helped also, because when mother had a history of skin complaints, when she was pregnant, she took a dose of Sorinum and it helped.
Okay, thank you. Thank you, doctor. Now, Dr. Amina, you can unmute and ask in last few minutes, as we are running in short of time. All others can have a discussion in next session, as ma'am will be coming with us in next session in 2 to 3 weeks. So we'll have a discussion later on this topic. The topic will be the continuation of the same. Dr. Amina, can you unmute? I think she can unmute. As we are running in short of time, it's my duty to thank the doctor. As we are, may I express my immense gratitude for this wonderful session by Dr. Shierly. We are very grateful to you here, to have you here, ma'am. We'll have, as I told earlier, we'll have a second session in 2 to 3 weeks. So that time, I know many had raised their hand in the last minute, but we are running in short of time. Malayalam session is waiting for us. They are waiting. So we have to end. That's why I asked sorry. So it will be announced in 2 to 3 weeks. Thank you, ma'am. Expecting more from this. Thank you so much, ma'am. Now, I know this week we all are very excited for our family meet to come. It's happening on very next Sunday at Vipin, Ernakulam. Please feel free to share your valuable suggestions. Let's all join together our hands to make this most successful one. Now, I thank each and everyone who are presented for this session. Thank you, everyone. Now, I welcome Dr. Hubert for the Malayalam session.
There is an announcement, madam.
Yes, Dr. Danish.
Tomorrow we will have a session from Dr. Prakash Rao, and he will be taking the last part of the management of hemophilia with homeopathic medicines. That is the 5th edition of the same subject, and that there will be a wonderful discussion coming on thereafter. Thank you, Dr. Shierly and Dr. Elizabeth.
Thank you, Doctor. Now we will have Dr. Hubert for Malayalam session. I welcome Dr. Hubert.